Hello, and welcome to this learning module. Today we're going to review the role air medical transport plays in the provision of emergency medical care. Upon successful completion of this learning module, students should be better able to identify the advantages and disadvantages of air medical transport, describe situations where air medical transport should be considered, and list considerations for safe air medical ground operations. So we have two different type of aircraft that are used with air medical transport. A fixed-wing aircraft refers to a jet that can be used for longer distance transports, while rotor-wing aircraft refers to the helicopters that we commonly see used for medevac operations. So a little bit of history here about the air medical usage. Back in 1918 was the first recorded medical air transport in the continental United States, and it was using a converted biplane that flew on January 28, 1918. The flight, which was considered part of a trial program by the United States Army Air Service, was conducted in Louisiana. 1947, Schaefer Air Service was the first FAA certified air ambulance service in the United States. It was founded by air medical pioneer Walter Schaefer as part of his larger Hollywood Ambulance Schaefer Ambulance Service that was located in Southern California. 1951, as medevac helicopter technology advanced substantially. By the beginning of the Korean War, helicopter medevac became a standard procedure. Some 17,000 soldiers, it's estimated, were medevaced from the front line during the Korean War, most in cots that were attached to the side of the aircraft. Transport to mobile Army surgical hospitals, or MASHs, was completed by these helicopter units. In 1970, the first United States civilian helicopter medical evacuation was performed by the Maryland State Police. They were transporting a critically injured patient using their Bell Jet Ranger to the University of Maryland Shock Trauma Center. Flight for Life became the first hospital-based helicopter program in Colorado. So air medical transport provides numerous advantages over ground transport, namely increased speed and maneuverability. The helicopter flies in a straight line. It can move at a faster rate than what the ground ambulance can do, and it's not limited by geography, availability of roads. So it can get into remote areas that maybe a ground ambulance can't get to. It's also important to consider that there are parts of the country that still do not have paramedic level services at least 24 hours a day, if at all. So having that helicopter can get them out to these remote areas that may not have advanced life support providers on the ground and get them the higher level of care that they need. Also, it provides personnel that have advanced skills and equipment. So helicopters may carry ventilators. Some helicopters can actually perform extracorporeal membrane oxygenation, or ECMO, which is a life support machine for failing hearts and lungs. They can bring blood and or blood products out to the patients. So there's some really good advantages. The disadvantage, though, is that air medical transport is susceptible to weather conditions, and if there's inclement weather, the helicopter simply can't fly. There are cabin size and weight limitations, so that needs to be considered. The patient's size and the patient's weight, depending upon the size of the ship that's coming to pick them up and whether or not they'll be able to safely transport that patient based on those restrictions. The cost of operating air medical transport is also extremely high, so that is definitely a difficult or a disadvantage of this. Air medical, costs can be $15,000 to $20,000 a flight. Another disadvantage is that it's just more dangerous than ground transport. So there is no specific data that directly compares air transport to ground transport at this time. However, there have been some studies that look at each individually. So in a 20-year period between 1992 through 2011, there were approximately 4,500 ambulance accidents. Of these, 29 resulted in fatal injuries. In a 10-year period between 1998 through 2008, there are 146 helicopter accidents, and of these, 50 or 34% resulted in fatal injuries. So what this tells us is that accidents involving air transport are more likely to be fatal than the ground accidents. The percentage of accidents that are fatal are roughly the same in fixed-wing accidents as well. So, what are some of the indications for air medical helicopter transport? A lot of these are actually guided by state and or local protocols. In general, if you have a critical patient needing faster transport and that transport can be accomplished by air much more quickly than by ground, whether it's a medical patient or a trauma patient, we should consider using air medical support for this. If you have a patient needing a specialty care facility that's just too far out to go by ground, air medical is totally indicated for that. Mass casualty incidents to get patients to the specialty care facilities while not burdening local trauma centers, burn centers, and other local resources. Another great use for air medical transport. And then also, if you're a BLS unit and you have no ALS coming to support you or a delayed ALS response, it might be faster to get advanced life support to you using air medical support. I will tell you that in South Carolina, the Clinical Operating Guideline 100-001 says we should consider air medical transport, if available, for patients with time critical conditions where ground transport time exceeds 30 minutes. Additionally, in South Carolina Clinical Operating Guideline 200-307, it encourages us to consider air medical activation for ST elevation MI patients when time to cardiac cath lab will exceed 60 minutes by ground. The image we see here is the inside of a Bell 429 medevac helicopter from the Mercy Flight 5 team in the Buffalo region of New York State. So we can get a kind of an inside look at what a rear loading medevac unit helicopter would look like. And as you can see, there's not a whole lot of space in there for the patient and crew. So in 2021, the National Association of EMS Physicians, along with the American College of Emergency Physicians and the Air Medical Physicians Association, released an update to their joint position statement on the use of air medical services. I believe prior to that, the last update was 2013. So they're recommending that air medical services should be used to accomplish one or more of the three primary patient-centered goals. Number one, initiation or continuation of advanced or specialty care that is not otherwise available locally from hospital or ground EMS resources. Number two, expedited delivery of the patient to definitive care for time-sensitive interventions. And or number three, extraction, evacuation, and or rescue from environments that are difficult to access due to geography, weather conditions, remote locations, distance, and other factors that might limit timely access to the patient or for timely transport by ground EMS. So indications for air medical jet transport include distance greater than what a helicopter can manage, long distance transports, when speed and efficiency is needed to get a patient someplace, and for cases requiring specialized equipment and personnel. So if you've ever watched the TV show that talks about the Coast Guard units that are located in Alaska, you might have seen that they will use a helicopter to go out and complete a rescue or a medevac airlift, bring the patient from a very remote area back to a less remote area, and then transfer them to a fixed wing air medical jet so they can be transported to a facility in a less remote area for effective transport. And that's actually what we see in the top image here. We've got the Coast Guard personnel assisting the LifeMed Alaska EMS personnel by getting an injured fisherman that was brought in by helicopter loaded to an actual jet that can fly the patient to more definitive care that's available at Anchorage. So in remote areas like this, the flight would just be too far for a medevac helicopter to fly. So that's why the patient is flown in by medevac helicopter and then transferred to the jet for transport. So these jets can cover vast areas quickly and efficiently, so it does make them ideal for international medical retrieval as well, and also transferring patients between hospitals that have, from a hospital that maybe has a limited capability to one farther away with more definitive care. Thing about jets is that they can also be used for other critical needs like transporting high-risk neonates, which is actually what we see in the bottom picture here. This is the inside of an air medical transport jet with a neonatal isolette, so it's set up specifically for neonatal air medical transport. Landing zone recommendations include a minimum of 100 foot by 100 foot. The ground should be level where the helicopter is landing, and we don't want any loose debris because the rotor wash can really kick things up as the helicopter approaches to land. It is very difficult for a helicopter to land on uneven terrain, and it's just not safe to do that. So, definitely, we need to consider that as well. The area should be free of bystanders and any non essential personnel. People love to watch the helicopter come in and land, but we need to keep them at a safe distance because, again, the rotor wash can cause debris to fly considerable distances. The area should be marked with weighted cones or emergency vehicles as per your local protocol. We don't want to use flares or any type of open flame for obvious reasons. The rotor wash will send the flares flying. And if it's at night, we need to be sure that we turn off all the vehicle headlights because we don't want to blind the pilot as they're coming down to ground level and landing the ship at the landing zone. So all landing zones need to be free of obstructions like power lines, trees, and anything else that the pilot may not be able to see when coming in from the air. And night landings are definitely a little bit more risky than what a daytime daylight landing would be. Many areas use their fire department to help set up the landing zones. They have the lighted, weighted cones so that at night it's safe for landing for the helicopter. So again, you're going to resort back to your local protocol when it comes to who sets up the landing zone, where the landing zones are. Many jurisdictions will actually have pre-planned landing zones, which does make things a little bit easier. So, some ground safety considerations include things like number one, we should never approach the aircraft without the pilot's permission or without a crew member stepping out of the ship and telling us or signaling to us that it's okay. In most instances, the crew will exit the helicopter and come over to us. In most instances, they don't want us approaching the ship until they tell us it's okay to do that. When we do approach the ship, we want to approach from the front so that we are in the pilot's view and the pilot knows we are coming towards their ship. It's important to remember not to touch stationary rotors because those will build up a lot of static electricity and that can be harmful. A hot load is when the helicopter lands and keeps the rotors going. The helicopter does not shut down, it actually keeps the rotors going. And many times, hot loads are done when you have a very critical patient, when the helicopter is low on fuel and doesn't want to shut down and then restart, and also if impending weather is coming in so that they can quickly load the patient and get back into the air before they're grounded by weather. Another thing to consider is a lot of medevac helicopters, as seen in the image here, do load from the rear. So we need to be aware of that tail rotor that's back there. Some of them are enclosed, and then in other types of aircraft, they're not enclosed. But we need to be aware of that, particularly with a hot load. So, flight crew and patient safety considerations. For every flight, the level of the risk to the patient and the crew that's going to be in the air needs to be carefully weighed against the reasonably anticipated degree of medical benefit to the patient. When it comes to hazardous materials incidents, if you're going to use a helicopter, remember that as they come in and as they land, they're liable to disturb whatever that hazardous material is. And then the other concern is that that patient needs to be decontaminated very well before putting them into an enclosed aircraft and flying them to a hospital. It's not like in a ground ambulance if the patient's off gassing and somebody starts to sense it or smell it, get a little dizzy. It's not like you can stop and open the doors. So hazardous materials calls are really, you need to consider very carefully as to whether or not it would be appropriate to use medevac for something like that. So medevac shopping refers to when an agency requests a medevac and they say that due to weather conditions they're not able to fly, so they have their dispatch center call a couple of other places to see if they can find one that will fly. Bottom line is, if one agency does not say that it's safe to fly, we really shouldn't be shopping around. We should initiate transport and not delay getting that patient to definitive care by the ground. Okay, similarly, air medical service agencies shouldn't engage in reverse helicopter shopping by seeking out and offering to perform transport missions that have been declined by the local service due to safety or weather conditions. So, and then the last thing is there really should be a coordination and centralized dispatch that can reduce unnecessary activation and dispatch. These ships cost a lot of money to fire up and to get into the air, when it comes to fuel costs and that sort of thing. So having a coordinated and centralized dispatch to coordinate all of your medevac units is really helpful, and it sort of prevents that sort of thing. It also prevents medevac shopping, and it ensures that we're getting the closest available helicopter service to our patient. So on this page, we see the resources that were used in addition to your textbook to create this learning module. If you type in the email addresses that you see for these two references, they will take you directly to the articles that were used. This brings us to the end of the presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, please consider going back to review any content that you might have struggled with. Thank you again for watching this learning module.